Hello, everybody. Hi, thank you so much for joining us, for joining today's EUHealthGov event. So today we are thrilled to welcome Sebastiano Lustig from the European Commission's Health Emergency Preparedness and Response Authority for a discussion on the role of HERA in the EU health security framework. So before introducing our speaker, I want to present a little bit the context of this event very briefly for those of you who are joining us for the first time. So EUHealthGov is a research network funded by the University Association for Contemporary European Studies and supported by the Erasmus Plus program of the European Union. The network is coordinated by Dr. Mary Guy from Liverpool John Moores University and myself, Dr. Charlotte Godziewski from City St. George University of London. And this event is part of our network's online quarterly seminar series. So these events have included in the past presentations by academics of work in progress, as well as roundtable discussions, practitioner perspectives, and more, always on the topic of EU health law or EU health regulations and governance. You can find summaries of our past events on our website, euhealthgov.org. And for today's event, we are honored and very excited to welcome our speaker, so Sebastiano Lustig. Sebastiano is the policy coordinator for prevention, preparedness, and response planning for medical countermeasures at the European Health Emergency Preparedness and Response Authority, so HERA. Previously, Sebastiano worked for DG SANTE, where his responsibilities included negotiating the European Health Union proposals on the serious cross-border threats to health regulation and the strengthened mandate of the European Centre for Disease Prevention and Control. Sebastiano is a social policy professional by background and has served as a consultant for several international organizations and governmental organizations, including the OECD, NATO, and GIZ. And so today he will be talking to us about EU health security framework and how HERA sits within it. The plan is for about 20 minutes presentation, more or less. We're very flexible. And that will then also be followed by a Q&A with the audience. And feel free to put your questions in the chat in advance, or you'll also be able to raise your hand later on during the Q&A, and I can unmute as required. Just a note also that the event is being recorded, so we would like to kindly ask you to mute yourselves for now to avoid any disruptions. Okay, so Sebastiano, if you're ready, the floor is yours.
Thanks a lot, Charlotte. So first of all, thank you very much for having me here. Within HERA, we are always excited and eager to engage with the variety of stakeholders because we are still, although we were established in 2021, for the Commission standards, we are still a baby. We're still relatively new. I think you mentioned, I don't need to reintroduce myself because I think you mentioned everything in your introduction, so we can go straight to the presentation. So today we're going to discuss the role of HERA within the EU health security framework. And when we, like this first slide is a bit of what I call the history of the EU health security framework, because the first thing that we need to say when it comes to health security is that within the European Union, the EU has limited competence when it comes to public health measures, because the delivery of public health measures remains within member states. So everything that we do when it comes to health security, the legal basis is Article 168, paragraph 5 of the Treaty of the Functioning of the European Union, that says the European Parliament and the Council may adopt incentive measures designed to protect and improve human health, and in particular to combat serious cross-border threats to health. So here again, you have a little bit the history. This is a bit how it was pre-pandemic, pre-COVID-19 pandemic. In 2001, the Commission established the first informal EU health security committee. In 2005, there was the creation of the European Centre for Disease Prevention and Control, which is currently based in Stockholm, Sweden. And then in 2013, Decision 1082 on serious cross-border threats to health, which was the decision that we used to act during the pandemic. However, as you'll soon find out, as you probably know, the pandemic has led to a series of reform that led to the completely restructuring of this EU health security framework. And when we talk about the European Health Union and this series of unprecedented reforms that have been negotiated, adopted, and also now are being implemented. So in the past couple of years, we have to start with the State of the Union 2020, when President von der Leyen announced the need to build a strong European Health Union. And the idea was really to strengthen EU preparedness and response to serious cross-border threats to health. So the very first pillar of the European Health Union was what we call the EU health security pillar. And the idea to strengthen the health security framework was, mainly through two different types of reforms. One is to reinforce the framework, and therefore the Commission laid out a proposal for a new regulation on serious cross-border threats to health. But also there was this idea of reinforcing the role of the key EU agencies. So there was one proposal to strengthen the mandate of the CDC, but also one proposal to strengthen the mandate of the European medicine agencies. Last but not least, in September 2020, President von der Leyen announced the need to set up a European BARDA. BARDA is an agency in the United States for biomedical advanced research and development. So indeed, this was, the first step that led to the creation of HERA, which ended up happening just a year later in 2021. I think it's very important to mention the fact that all these proposals that I've just mentioned, including the creation of HERA, they're all based on the lesson learned from COVID-19. The lesson learned from COVID-19 are really the raison d'etre for the health security pillar of the European Health Union. And these slides a bit on the left summarize what are some of the main lessons learned. I mean, we immediately recognized at EU level that there was suboptimal preparedness plans and modeling, but also fragmentation of efforts at EU level. I think you all remember the fact that at the beginning of the pandemic, member states were competing within each other for the same medical countermeasures, which was, of course, very inefficient and had an impact on health outcomes. So indeed, there were also vulnerabilities in global supply chains, but an insufficient oversight of manufacturing capacity and research priorities. So no one really had, at the very beginning, in the very first phase of the pandemic, no one really had an overview of who was doing what and where. And when you don't have an overview, of course, then you cannot, or it's much more complicated to implement evidence-based decision-making. Luckily, throughout the pandemic, we also experienced some of the benefits of European coordination. I think the classic example is the EU vaccine strategy. The fact that the EU level advanced purchase agreements for vaccines have enabled member states to secure all the doses they needed to protect the European citizens, but also the Commission used very often the joint procurement tool, which have enabled the purchase of many critical medical countermeasures. So in sum, the COVID-19 pandemic has demonstrated really the need and value of this coordinated EU level action. Hence the proposals that I've mentioned in my previous slide, hence the creation of HERA. So established in 2021, HERA was created to improve EU preparedness and response by ensuring access to medical countermeasure. And here I will just stop for a second just to give you a bit of a definition of medical countermeasure, because otherwise everything seems a bit too abstract. And for medical countermeasure, the definition is within the serious cross-border threats to health regulation, but what we mean is really medical products, medical devices, all service that serve to for the purpose of preparedness and response to serious cross-border threats to health. So as you can imagine, it's a very high-level, broad definition under which you can have vaccine, mask, and various personal protective equipment. So indeed, HERA's action is done through a series of actions that really follow what we called an end-to-end approach. an end-to-end approach to medical countermeasures. And with end-to-end, what we really mean is really that HERA follows MCMs from the very first phase, which is threat assessment. So identify, also thanks to the work of the CDC and our international partners, identify the priority threats, and then based on that, conducts a series of actions that range from research and development of crisis-relevant MCM in case there are no crisis-relevant MCMs available, production through reservation contracts, joint procurement, which we described earlier, and finally, the stockpiling of crisis-relevant medical countermeasures. So this is a bit what we mean from end-to-end approach. HERA has two modes of operation. We have a preparedness mode and the crisis mode. And the crisis mode really builds on another regulation that has been adopted, negotiated and adopted in the course of the pandemic, which is what we call the emergency framework regulation that gives extra powers to HERA in case of a public health emergency at union level. But we'll discuss that a bit later in the following slides. This is a slide that is a bit HERA-centric. It's HERA and its governance, but it really gives you, I think, the main message that we want to pass with this slide is that pandemic preparedness and response really requires very much an holistic approach. So we really need all the stakeholders sitting at the same table. That's why HERA, as mentioned earlier, really engage with a variety of stakeholders. Of course, first and foremost, member states via the HERA board. We have this board within HERA with one member state representative per member state, so 27 in total, commission services. So that's really the main structure providing guidance to the work of HERA. But at the same time, when it comes to prevention, preparedness, and response planning, you need to engage with industry. That's something that came out quite clear during the pandemic. That's why we have within HERA a Joint Industrial Cooperation Forum. But we've also seen throughout the pandemic the critical role the civil society play, especially when it comes to the implementation of certain measures. And that's why within HERA we also have a civil society forum. So the civil society is really actively involved and engaged in the work of HERA and also in the development of the HERA work plans. Of course, as I mentioned earlier, HERA cooperates on a daily basis with the two most important EU agencies when it comes to preparing and responding to pandemic, the EMA and the CDC. We have signed working arrangements in 2023 that defines a little bit better the level of cooperation. And also, HERA has a very important global dimension. We have signed working arrangement with several countries, including the United States, Japan, Korea, because I think one of the main lessons learned from COVID, something that might seem obvious, is that, of course, pandemics do not stop at borders. And at the end of the day, no one is safe until we all are. That's why we need to cooperate more, not only at European level, but also at global level. These slides is related to what we were saying earlier. In case of a public health emergency at union level, there is a procedure, there is a regulation that gives extra powers to HERA. I know that the first part of the slide might be a bit complex. It pretty much shows the various steps to activate these emergency framework regulations. So first, you will need a public health emergency to be recognized at the EU level, and the legal basis for that is within the Serious Cross-Border Threats to Health regulation. And then the Council may adopt the activation of the regulation. And at that point, there is the establishment of new structures that will guide decision-making in future serious cross-border threats to health, which is the Health Crisis Board. And this Health Crisis Board, if activated, it has never been activated until now, but if activated, will play a very important role because it has really the mandate to ensure coordination of action by the Council, the Commission, and the relevant union bodies when it comes to medical countermeasures. The composition of this health crisis board is that it's composed once again by high-level representatives from member states, but also by the Commission, and it's co-chaired by the Commission and the rotating presidency of the Council. This is a very important point because this is the only structure within the EU health security framework that is co-chaired by the Council. And once again, the reason for that is that you really need to have all the most important stakeholders sitting at the same table if you are tackling a pandemic. Under the emergency framework, there are a series of measures that can be introduced, and these slides summarize some of them. We have mechanisms for monitoring crisis-relevant MCMs, and this is very much linked to what we said at the beginning, the lesson learned from the COVID-19 crisis, this lack of overview. Well, now in this emergency framework, we have measures that can address that. There is also, of course, the very important possibility for procurement, purchasing, and manufacturing of medical countermeasure raw materials, but also there is the possibility to activate emergency funding or also emergency research and innovation plans. So as you can see, there are really a series of measures that can be activated in case of a public health emergency at union level. In the next two slides, there is a bit of a case study. We are using pandemic influenza to really show what HERA can do to support member states and ultimately citizens in case of a pandemic. I mean, we are using here the case of pandemic influenza. We are aware that influenza viruses have caused more global pandemics in human history than any other pathogen. And some of the challenges include the fact that better medical countermeasures are needed, especially for risk groups, but also that the scale of event demands very fast and very large response. And so here we really have a slide that I think summarizes well what we call the union support capacities. So really what HERA can do, what HERA and the other Commission services can do to support member states. And here we have this motto, the right intervention for the right medical countermeasures, and a range of actions going from supporting intelligence capacities, but also supporting clinical and preclinical development of next generation influenza vaccines. On this point, I have to mention that HERA in the past year has recently established another structure, which is the coordination mechanism for clinical trials. Even when it comes to clinical trials in Europe, there was quite of a big fragmentation in the context of the pandemic. And this coordination mechanism is a structure that has been purposely established to reduce this fragmentation and therefore ensuring an optimal allocation of resources. Of course, HERA would also manage the joint procurement of antivirals and vaccine manufacturing capacity reservations. And lastly, as we mentioned earlier, the possibility to do stockpiles of H5 pre-pandemic vaccines. In terms of next steps, you may be aware that HERA is working under the political guidance of Commissioner Labib, which is our Commissioner for Equality, Preparedness and Crisis Management. So now the Commission have one Commissioner whose main task is really preparedness and crisis management, and HERA has been tasked to develop a new strategy to support medical countermeasures against public health threats, and this strategy will be published this year. Another activity that we will continue to implement, which is very important, and it's something that it did not exist before the pandemic, is the fact that HERA will continue to support the CDC in the assessments of national prevention, preparedness and response planning. So what we do is to assess the level of preparedness of member states when it comes to medical countermeasures. With this, I've concluded this brief presentation, but I'm happy to take any questions. Thanks a lot.